Hello, my name is Lysandra Pittman, and my presentation today will cover bipolar disorders, which is covered in our text in the chapter 11 on mood disorders. And bipolar disorder is the coverage begins on page 327. The journal that I chose was the Journal of Psychiatry and Neurological Science. This was the 2003 issue number 26, pages 139 to 147. Bipolar Disorder and Suicide is the title, and the authors are Melikwa Jenquin, Iroglu Ganka, and Lut Tarmon. So, bipolar disorder, the symptoms consist of depression, broken down into four components: affective, cognitive, behavioral, and physiological. The affective symptoms of BD occur in the mania episodes and include elevated, expansive, and irritable mood. In the study, the relationship between subtypes of bipolar disorder and suicide was investigated. Suicide was more common in bipolar 1 disorder compound as opposed to the bipolar 2. Now, this struck me as kind of odd because most suicide is attributed to being depressed. And we know from chapter 11 that bipolar 2 is recurrent major depressive episodes with hypomania, and bipolar 1 is a single manic episode and most recent episodes of mania mixed with depression. So, the aim of this study was to determine the frequency of suicide attempts, methods of suicide, and clinical factors associated with suicide in outpatients who were ematic, and who were and had follow-ups in the Kurakova University Faculty of Medicine and Psychiatry Department Bipolar Disorder Unit. The hypothesis of this study was the rate of suicide attempts was high in patients with bipolar disorder and that had a family history of psychiatric issues. The gender is most frequently studied variable. It's been found that in bipolar patients, suicide attempts are 2 times more common in women, but completed suicide is more common in men. Manic patients feeling hopeless, impulsive, hostile, and aggressive affect the way the suicide is carried out. The university conducted a study on a group whose ages ranged from 18 to 65 and diagnosed with bipolar disorder. Those with other existing active psychosis and dementia were excluded from this study. The study consisted of, after going through all the different trials of who had pre-existing conditions and who had a history of psychological issues, they didn't want to select people who had previous issues and made either the results of the study. So when they finished going through that process, the study consisted of 60 females and 62 males. Patients were given questions that were broken down into sections with questions that were oriented on a specific topic, such as socio-demographic features, which allowed the researchers to compare the patients with and without attempts in terms of socio-demographic features. Researchers also studied the lifetime comorbidities of patients with or without suicide attempt, family history of patients with or without suicide attempt as well. The importance of the study was to show that some clinical and demographical features were associated with the suicide attempts in bipolar disorder. From a gender standpoint, women attempt suicide more frequently than men. Suicide risk is 4 times higher in women with bipolar disorder than with men with bipolar disorder. Researchers found that a strong association between suicide attempt and family history of psychiatric disorder. Suicide attempt in patients with bipolar disorder is a serious public health problem. Important factors are early diagnosis and treatment. This study shows that the frequency of suicide attempt is quite higher than most people may believe. Researchers believe decreasing the period without treatment and provency mood episodes must be the essential target, especially during mixed depressive episodes. Evaluate the risk of suicide, investigate the bipolar polar, polar, bipolarity, and inform the patients and their family. Now, according to the text, comorbidity is high because bipolar disorder is commonly associated with other medical conditions such as heart disease, hypertension, diabetes, and so forth. And that mental health problems, anxiety, smoking, drug abuse, and suicide also plays a role. So, the treatment of bipolar disorders, although there are no specific drugs targeted for bipolar disorder, there are drugs that are targeted for the symptoms to help reduce the risk of suicide and other harm to the patient. The drugs used for depressive disorders or bipolar is lithium, Deprotect are typically given to the bipolar patients. Lithium is also a mood stabilizing drug to prevent or reduce future episodes of bipolar disorder and has an anti-suicide effect, which would be beneficial seeing as how this study is targeted on people with bipolar who have suicidal thoughts or who have actually carried out the attempt of suicide, and now they're being treated to try and help them no longer, have these feelings of suicide. And most patients are maintained indefinitely on lithium. So this is something that once they're diagnosed and once they're showing signs, or maybe sometimes, like the study said, in order to prevent it, lithium is given once these people are diagnosed with bipolar. But as we see in society today, bipolar is becoming on, I guess you should say, it's like on the rise. People may have always had it, but even in my family, no one wants to go and see a psychologist. Everybody wants to just put it off as they're feeling a certain way, when there are a lot of people who are actually walking around who have bipolar disorder. So it's a good thing that the media, I guess you should say, and more people are focusing, and researchers are focusing on bipolar, and more people are coming in and get tested for it, especially around the holidays. That's another reason why I picked this journal, is because a lot of people know that suicide is high among the holidays, just as the lady on 63rd and State Street at the Red Line just recently jumped in front of the train and killed herself. And it's unknown to me why she did it, but that just really made me think about what journal I decided to pick and what I wanted to speak about, which was bipolar and suicide, because I know that people with bipolar, when they go through those manic phases, they're up and, they're feeling good. Well, not feeling good, but on edge, and they're hyper, and, but when they're on the depressive phase and they're depressed, they are really low and feeling like it's the end of the world, and sometimes take their lives. Some people are successful and some people are not. But that is why I picked this subject to speak on, and As I was saying, most patients are maintained indefinitely on lithium or other mood stabilizers, and